Yes, I think so. Okay, so today we have a patient who is admitted to med-surg, and our order is to insert a Foley catheter for urinary retention. Our diagnosis is a urinary tract obstruction. What we're going to do after we get our Foley catheter in is we're going to obtain a serial urine culture, and we're going to monitor our strict INOs and report any output of less than 30 milliliters per hour. So we're going to go ahead and get started. I verified that everything in here is intact and not expired, and we'll go ahead and enter the lab. So, knock, knock, knock. Hello, my name is Lindsay. I'll be your student nurse for today. I'm going to pull up my patient sheet. All right, can you verify your name and date of birth for me? And do you have any allergies? Just to latex and iodine. Okay, so we're going to go ahead and we're going to do a Foley catheter today. I'll kind of explain everything as we start to get everything ready, but first I'm going to set up the room and make sure that we're ready to go, okay? Alright, so I'm going to start by providing privacy. Okay, I'm going to move the trash can to where I want it. I'm going to go ahead and raise your brother. You ever had a Foley catheter before? Yeah. Alright, so I'm going to lift this up to a working height here. Okay, I'm going to wipe down my surface. Wipe down. Okay, so everything is clean now. Go ahead and get started. Okay. Alright, Ivy, so what we're going to do is we're going to insert the Foley catheter, and we're going to obtain the specimen like I said. So what I will have you do, I'll kind of explain it. This procedure should not be painful at all. You might feel a little bit of pressure, but not. You shouldn't feel any pain, so if you feel any pain, just raise your hand, let me know. We can go ahead and stop and reassess everything. So what we'll do is, through this, there's some lubrication. We'll go ahead and lubricate the Foley catheter, and then we'll go ahead and place it. After that, I'll check to make sure that it's in the proper area, and then we'll go ahead and collect our specimen from there. Do you have any questions before we get started? No? Okay. So the first thing, I'm going to drop this side here down. Okay. I'm going to go ahead and I'm going to pull back your blanket here. Alright. I'm going to make sure I have all of my supplies first. Okay, so I've got everything for the catheter Foley, and then I have everything for my sterile specimen after that we're going to obtain. So the first thing I'm going to do is I'm going to grab my container. Ivy, is it okay if I place this on the bed here? Okay, so we're going to be moving. I'm going to be setting up my sterile field, so I'll have you just stay as still as possible for me, okay? So I'm just going to place this in between your legs here. Okay, all right, so we're going to have you sit in the dorsal recumbent position, so just froggy legs here. We're going to still try to keep you covered while we get set up. Great job. All right. So as you can see, we already have a pad under here, and this is just a washable chuck. We've got Ivy covered up here. We're going to go ahead and get started. So I've got clean gloves on. I'm going to go ahead and grab our to move. Okay. Alright, so with this here, I'm going to open up, sort of this way. Alright, so the first thing I'm going to do is I'm going to go away from myself and then outwards. So I'm gonna pull down just a little bit. So away, outwards, outwards, and towards. So now that we have our sterile field, we're not going to reach over, so we're just going to adjust as needed. So the first thing that I am going to do is I'm going to adjust the sides just to give myself a little bit more room. And I'm just using that 1-inch border. And I'm giving myself plenty of room to put on my sterile gloves. Okay, so now that we've got that started, we'll go ahead and start by cleansing the area. So, Ivy, I'm going to go ahead and expose you now. Is that okay? Yep, alright. Okay, so we've exposed the area. The first thing we're going to do is clean the perineal area. So we're going to go ahead and clean that. Okay. So now that everything is clean, we're going to go ahead and get started on our catheter. So I've got this we don't need. Okay, and we're going to go ahead and start our sterile field. So I'm going to grab one of the edges. And we're going to lay the shiny side down. So you can see the shiny side is facing towards me over here. And I'm going to place it down. Okay, so now that that's placed down, we're going to take this one here, and we don't need this one, so we're just going to throw that away. So now it's time for our sterile gloves, so I'll go ahead and throw my gloves away. Perform hand hygiene. And come back to the work area. I'm going to grab my sterile gloves. I'm going to do it on the side of the bed. Being sure not to touch them. Okay. So I'm going to grab the inside of the glove, not the outside. I'm going to slide my hand in. And we can adjust this after we get the other hand on. So grab the inside.
Okay, I've gathered all my supplies. None of it is open, none of it is expired. I've checked my chart and
Place my hands in here. Okay, so now that I have both of them on, I can go ahead and adjust as needed. My hands must be a little sweaty. Okay.
We'll give it a try.
Okay, we're gonna go ahead and get started now. Okay, perfect. All right, so the first thing we're gonna do is I'm going to take the iodine here. And our mannequin is allergic to iodine, so we're not gonna use iodine, but we're gonna use another solution. So pour that on there. I'm gonna go ahead. I'm going to move up the area. Okay. Make sure that is ready to go. Okay. So now we just underneath that. Grab this here, place that in there. We'll go ahead and get started now that we are ready. Alright, Ivy, so we're going to go ahead and get started here. I'm going to make sure this is nice and open. Okay. So go on the outside.
Alright, so I've checked my orders
This
and I
side
am
here.
going to put in a sterile Foley catheter and do
Right down the middle.
injection for my patient with a possible urinary tract obstruction.
We're going to go ahead and get started. Alright, Ivy, so I'm going to have you bear down for me. Alright. So the catheter is inserted. We're going to insert it a little bit further. Okay. We're going to go ahead and fill the balloon. And that is going to be according to here. So this is 10 milliliters. We're going to do it slowly. Alright, Ivy, you might feel a little bit of pressure. You shouldn't feel any pain. Okay. Alright, we're going to go ahead and tilt slightly. Perfect. Okay, so we are all done with that for now. I'm going to take this. I'm going to put this onto the side. Alright, so now we're done with our sterile field. I'm going to go ahead and perform hand hygiene.
Just latex.
We have a new pair of gloves. I'm going to go ahead and get your mixture up here. Okay, so we're going to place this in the strap. Make sure that we have not too much resistance. Okay, and now we're going to go ahead and collect our sterile sample. So make sure I've got everything here. I've got my sticker and I've got my specimen container. I'm going to grab my syringe and my alcohol prep. So first thing first, I'm going to open up the syringe. Make sure I place this here. Open up my alcohol prep. Wipe this down. Be sure not to touch it. Okay, I'm gonna lock this on.
Okay.
Alright, pull back 5 milliliters. Unlock it. I'm going to make sure that I do not touch the lid, so I'm just going to prepare it over. Alright, I'm done with that. Dispose of that. Place the lid on. I'm going to label and date my urine specimen here, and I'm going to send it off to the lab. Alright, Ivy. So during that, I would have clamped this here and unclamped it. Okay, throw this away. Alright, so we can go ahead and get rid of everything. I'm gonna go ahead and cover you up now that we're done. Okay. Go ahead and dispose of everything. down.
I'm not gonna open them for the sake of.
Is that comfortable for you? Okay. Alright, so I'm gonna go ahead and cover you back up. Make sure we have a call light here for you. I'm gonna raise this arm back up and make sure it's locked. Okay. We're gonna lower you back down. And I'll be back to check on you in 30 minutes. Is there anything I can grab for you? Okay. Make sure we didn't touch the hand. Okay, I'm going to send this off to the lab. Take my gloves, perform hand hygiene.
That's what I was thinking.
Alright, we're going to send this off.
As soon as
And we're going to make sure that we document everything that we did today.
yeah.